Welcome back to this segment of Healthcare Consumerism Radio. This is Brent Macy, joined with my host, Doug Field, and want to bring another leader onto the program with us for this segment here. We've got Chris Riedl, who is the head of product for national accounts at Aetna. Welcome to the program, Chris.
Thanks, Brent and Doug. Happy to be here.
Nice to have you here.
Now, Chris, you've been in the industry a long time, and for this segment, we're really looking at what you guys are doing there at Aetna. Kind of give us a snapshot of what Aetna does in the consumer-driven plan side of things, and we'll dig a little deeper.
Sure, absolutely. So, Aetna has been offering consumer-directed plans for a long time. We were actually the first national insurer to offer consumer-directed health plans broadly. And we've been doing that now for about more than a decade, and we've got about nearly 3 million members across both health reimbursement accounts and health savings accounts. So we do offer both products. Now, we've been a leader and an innovator in the development of these plans, and we have continued to make improvements in our offerings based on our experience and our research with employers and members. And you guys are probably aware that each year we conduct an annual study comparing the experiences of employers and members with our Aetna Health Fund plans as opposed to those in more traditional or PPO-based plans. And our study is the longest-running study of its kind in the healthcare industry. And, in fact, we're currently finalizing our 10th annual study, which goes along nicely with your 10th anniversary here. And we hope to be releasing those results over the next couple of months.
Now, Chris, a lot of we hear all the time in the marketplace that you look at more of the traditional plans out there, they're kind of staying stagnant, and the consumer-driven options, they're the ones that are really growing the most, correct?
Yeah, absolutely. We are continuing to see growth across our plan offerings, and I think we're going to continue to see that happen even under the Affordable Care Act and in the exchange environment.
Chris, we were just talking to Dr. Nealman with Health Equity on the previous segment, and we also were just in Minneapolis this week talking with quite a few players up there, and there seems to be a real movement towards full replacement. Do you see that among your current customer base?
We see a little bit of both. Depends really on the employer strategy and what they're looking to achieve. We've studied the experience under both types of options, and what we've found that employers that completely transition to an Aetna Health Fund plan, they definitely see the most dramatic cost savings. But employers who are taking those first steps and looking to introduce consumer-directed plans with their population as an option are still seeing some significant reductions in their health care costs. So, for example, with our study, we reviewed and saw that employers that offered an Aetna Health Fund plan option saved more than $190 per member per year for members enrolled across all their health plan options. And we believe that's because they're beginning to create a culture of consumerism and a culture that encourages active management of health. So, again, we are seeing both plans being offered as an option, especially if they're transitioning and trying to help employees move into those types of plan designs, and also total replacement, depending upon what they're looking to achieve in terms of cost savings.
Hey, Chris, as you and the teams at Aetna look at the emerging public and private exchanges, we know all the fiasco happening around public exchanges, but let's just say that moves forward. But the emergence of private exchanges, where do you see that, particularly as it relates to, the consumer-driven plans?
So I think that, certainly not just my opinion, I think we're starting to see this demonstrated from the activity that we are seeing on the exchanges, is that CDHP plans are here to stay. They're two of the primary goals of healthcare reform: lower healthcare costs and improve people's access to appropriate healthcare. And what we found with, our decade of experience with these plans and research is that these plans can help achieve these goals. So the consumer-directed plans encourage people to become more engaged, more aware of their healthcare costs and costs associated with the care. And we anticipate we're going to continue to see more and more interest in these plans as employers are looking for ways to refine employee health tax benefits to avoid that 40% excise tax or Cadillac tax on high-cost coverage. So I do think CDHPs will be an appealing alternative on the exchanges as consumers make value comparisons. So we're seeing that already with the early adoption from employers that are participating on the private exchanges.
Chris, you talked about the transition that employers are having to take their employee populations through. I kind of got a two-part question, and what does the employer need to do to help their employee population kind of with this behavioral change? Because it's something that they're not used to. It's a whole different way to look at the healthcare benefit system. And then my second question is, what's the importance of wrapping the right tools around a consumer-driven health plan if you're going to offer it to your employee population?
Yeah, so it's a great question because I think, it's not just enough to offer a consumer-directed plan and even to just put some small communications around it. Otherwise, it's just a plan design. Mm-hmm. So you really do have to offer those tools and resources to provide greater transparency into healthcare costs. If you're transitioning from a plan that's got lower deductibles or even co-pays, because those still do exist, employees have to understand the costs and how to maximize the dollars in the HRA or HSA. So we've had some good experience in this place. We have a number of different tools that we make sure that are available not only just broadly to our membership, but especially with our consumer-directed plans. So self-service member portal, where the members can go to get access to tools and resources. We have a personal health record that integrates information from claims systems, wellness programs, self-reported data from our members, that it allows them to share that information with their healthcare teams. And the PHR can also help identify potential issues like dangerous drug-to-drug interactions, gaps in care, and helps bring that to the attention of the healthcare provider. One of the most important tools that we make available, and we're definitely seeing these types of tools emerging across the industry, are cost estimators. So we have a member payment estimator tool which allows members to get real-time out-of-pocket cost estimates for more than 650 commonly used services, and it's based on the member's plan design, so takes into account deductible, co-insurance, but also the negotiated rate with the particular provider that they're looking to see. And we found that for more than 30 of the most commonly selected healthcare services, when members are using these tools, they're choosing providers that are allowing them to save about $170 in out-of-pocket costs per service, and for the employer, that's about a $612 reduction in allowed expenses. So these tools are critically important for members to really get engaged in their health plan and into these consumer-directed plans. So again, not just a plan design change, you have to give them access to the tools and resources so that they can effectively navigate their plan. So
this is your suite of cost of care transparency tools you're talking about, right, Chris?
Correct.
Yeah, okay. Let's see. What is Aetna's Healthy Actions Incentive Programs? What's that?
So we do offer incentives. That's our incentive program. It's a good point that you asked that question because we have seen that in terms of helping members understand and utilize their health care, we found some best practices. So this is allowing employers to get the most value of their offerings through their employees. So some of these things include comprehensive communication strategy, which we just talked about, but also combining wellness and care management programs, and to drive engagement in those programs, and encouraging healthy behavior, incentives are a critical component of that. So folks that have used these best practices have had cost savings. We talked about option versus total replacement. Those that are doing even option business, if they employ, wellness and care management and incentive programs, they're seeing cost savings almost as high as employers who completely switch over to health fund plans. So, and we've also seen over the years employers taking a different strategy. So if they've had a consumer-directed plan in place for several years, they may move away from that upfront funding of an HRA or an HSA and allowing employees to earn those dollars back through wellness incentives.
Chris, when you look, and Dr. Nealman alluded to it in the previous segment, and from his physician background, he said, I love it when I see a patient who comes in and cares about their health care and understands and they ask me the right questions around care. Do you see from your traditional plans to your consumer-driven plans, is there a different knowledge base between those two plan members?
Yeah, we're definitely seeing it in terms of their rates of accessing care. So you guys are probably familiar with that popular criticism that's out there on consumer-directed plans.
Yeah.
People with these plans are going to avoid necessary care. And our experience has, in fact, shown the opposite of that. So, there are members in our Aetna Health Fund plans, they're getting higher rates of preventive care. So they're getting preventive care from primary care docs about 11% more than members in a traditional plan. We've also found that they're getting those really important screenings at a higher rate, so things like cervical cancer, colorectal cancer, prostate cancer, mammograms. All of these at a higher rate than PPO members. I would say our experience, we've seen it range anywhere from 7 to 10%, depending upon the type of screening. We're also seeing higher rates of immunization. So the important distinction here on preventive care, we all know that it's now going to be covered at 100% because of the Affordable Care Act, but members in our plans have had 100% preventive care coverage for quite some time, and they're accustomed to actively managing their care. So we think that that's what's contributed to seeing a better rate of access of preventive care under these plans versus the traditional plans. And it's kind of encouraging to see, so you're thinking, okay, they're accessing all this care more. What is that doing for cost? But in fact, members of these plans are actually spending less on some of the other types of healthcare services. So things like specialist doctor visits, emergency room visits, and total pharmacy costs, those costs are being managed more effectively as well. So I think he was absolutely right, and it's very encouraging to see the engagement rate and the types of results that we're seeing with members in these plans.
Chris, we've got about a minute left on the program, and I want you to be able to tie this together for our audience and kind of give them one or two different takeaways from your health plan perspective on, consumerism, HSAs, and what they need to really be focused on.
Yeah. So, as we've talked about, I think important to note that consumer-directed plans are not going away. I think they're going to be an important aspect of an employer strategy, whether they're offering coverage on or off an exchange. Great way to avoid that Cadillac or excise tax. But I would reinforce that it's more than just a plan design, and it's not about cost shifting. Really need to have strong communication strategy and wrap that with the tools and resources and incentives to create that consumerism feel and strategy more broadly. And we've seen tremendous results, as I've said, 10 years of study that have demonstrated year over year the types of cost savings that can be achieved in these plans, not only for members in helping them save money, but also for the employer. So I think CDHPs are here to stay.
And with Aetna, you guys have always been a leader in there. Is there one thing that you hear from your employers around these plans all the time that they come back to you with?
Yeah, I would say very satisfied with the results. Our most recent study is that employers that replace their traditional plans with a consumer-directed plan are seeing a savings about $350 per member per year. Mm-hmm. And in the national account space, which is where I work, many of the larger customers are offering these plans. And the lower health care costs have resulted in savings of $20.8 million over a 6-year period in our study. So that's pretty dramatic and impressive results, and I think that the increase and continued increase in membership in these plans are demonstrating that they do work and the employers believe in them.
Well, Chris, thank you so much for joining us on the program today, and have a great weekend.
Great.
To the rest of our audience, please stay tuned for the last segment of Healthcare Consumerism Radio.
Thank you.
Thanks, Chris.
This was